parents can be, especially with this type of condition, they can maybe, they're overwhelmed, they're trying to manage it as well. How have you helped coach the parents through all of this? I'd imagine that's also part of what you're trying to do, because that will also help the child.
Absolutely. Steering them away from the perfection model, that everyone comes in with that. They feel like that I am the expert and that somehow they're supposed to be performing better than they were last time. I have to keep telling people, you're doing a great job, you're doing fine. Yeah, but I still had some highs here and some lows here. Overall, you have to give them an overall assessment. You have to praise them for the effort, not for the results. As I just mentioned a few minutes ago, I did exactly the same thing yesterday as I did today for lunch. I got totally different results. So that's just the reality of living with this. I understand that. Now, maybe people that don't live with this like we do see it different, and they convey a different emotion to their patients, like they should have been able to figure that out. No, stuff happens, and we all know that. And that's I think the wisdom all three of us have accrued from living with this condition for so long. I try to convey that the best I can to the parents. As I said earlier, from the get-go, and at every visit, I keep saying that. And so I'm trying to work on efficiencies, trying to not expect perfection, and I tell them that up front, and I praise them for as many things as I can find that I have objective data for their efforts. And notwithstanding just how they care for their child, it's more than just, it's putting a roof over their kid's head and spending time with them, just being good parents. I oftentimes are just praising their parenthood as well. It's a holistic way of looking at this, because it's not just what they do with a number or a meter or a pump setting, that they're making every effort and then balancing their own lives, that they have time for themselves. Do you have any time to go out with your spouse? Do you go out to the movie every now and then? You got somebody who can watch the kids? You need to take care of yourself too. We're managing a family here, not just a person or a child with diabetes.